Hello, everyone. Welcome to the Supporting Youth Mental Health, Place-Based Solutions for Thriving Communities webinar. My name is April Shine, and I'll be moderating today's discussion, Introducing the Wellness Zones Initiative. Thank you for being here. I run my own consulting practice, Shine Strategies, and have had the pleasure of working with place-based efforts locally here in Pierce County, across the state of Washington, and nationally. Before we jump into today's discussion, next slide, sorry. Before we jump into today's discussion, I'd like to acknowledge that there are 29 federally recognized and 7 non-federally recognized tribes within Washington state. We encourage you to learn more about the histories, cultures, and traditions of the Indigenous peoples and how we might build relationships, create more inclusive spaces, and foster innovation and collaboration. Next slide. Couple of housekeeping tips before we jump in. Please use the chat functions for technical or logistical questions. Use the raise hand function to ask a content-related questions verbally at the end of the presentation when we get to the question and answer section. Or use the Q&A function to send your written content-related questions at any time. The existing shortage of mental and behavioral healthcare providers highlights the limitations of solely relying on treatment to address youth mental health and wellness. New strategies need considered as part of the government's response to the current youth mental health crisis. Given research showing the impact of social and physical environment on youth mental health, place-based collective impact approaches may be well situated to address the intricate factors related to child and adolescent well-being. A statewide partnership funded by a Washington state legislative proviso sponsored by Senator Nikki Torres, who's joining us today, is coming together to determine whether community-informed and embedded approaches, youth wellness zones is what we're calling them, can create meaningful positive change in youth mental wellness. Today, we're going to get to learn from Senator Nikki Torres, who sponsored the legislative proviso supporting this initiative, and leaders from across the zones involved in this initiative. The 4 zones currently are Yakima, Spokane, Renton, and Parkland. Each of these 4 zones will engage young people in defining wellness and informing the larger field about what is missing in communities. The zones thoughtfully involve children and adolescents in civic planning and place-based innovation, centering community connection to directly and indirectly impact individual youth well-being. As I jump into the questions, I'm going to be asking each panelist to share a little bit more about themselves. But please, thank you very much, all of you, for joining us today in this discussion. I am going to kick us off with a specific question. The overarching question to all of you is going to be, why take a place-based approach to youth wellness? But I'm going to target it and start with you, Senator Torres. First, by saying thank you so much for taking a risk and investing in this program through the legislative proviso you sponsored and championed last session. And also ask you, what made you support an approach to this? And if you could just give us a little bit of background before you get started.
Yeah, absolutely. So Nikki Torres, State Senator for the 15th Legislative District, which covers portions until January 1st of Grant, Adams, Yakima, Franklin, and a little portion of Benton. Oops, sorry, my screen just moved. So with that, you can, just by hearing those counties, you'll know that there's a lot of rural areas. And in a lot of those rural areas, we don't have access to mental health professionals or the care, especially same-day care. And that we've seen across the board. And not only that, but those areas have a large Latino population. And the stigma has always been that, oh, we don't go to do those things. We don't admit that there's something wrong. But we're trying to reverse that stigma to make sure that people know that it's okay to seek help. And when it's okay to seek help, but then we don't have the resources, then there's an issue. So we want to make sure that there are resources available, especially in our rural areas, which I have a lot of currently in my district, and especially for the students that are wanting to seek that help. And even if it's remote, I tried pushing a bill through to make it where it's like a telemedicine bill for the youth to access same day mental health resources. But unfortunately, that didn't go through. So then we turned it into a proviso, which I'm glad that that ended up working out. But we still need more access, more resources. We have a workforce shortage, and we all know that, and especially in our rural areas. So, and thank you for having me here, April.
Well, thank you for joining us. Now I am going to ask each of the representatives from the zones to answer. And I should also note that Senator Torres is also part of it represents the Yakima area, which is speaking on behalf of our Yakima's Wellness Zone. Jenna, do you mind introducing yourself a little bit and also explaining how your place-based initiative is approaching the zone project?
Absolutely. Thank you, April. I'm Jenna Ray. I was a classroom teacher, P12, for 20 years before moving to the state level for policy and advocacy around education and workforce development needs in our state. And now for the past 6 years, I've been in Spokane working in our place-based resident-led initiative called The Zone. So we are driven by community voice from students and families in Northeast Spokane and grant funded to work on issues that are raised as goals for students and families in Northeast. So this Youth Wellness Zone project has allowed us to dive deeper into the topic area of wellness, expanding the amount of hours that our team and our community funded partners are directly engaging with youth. So as we were considering this opportunity this summer, the first thing we did is create a youth wellness survey, and we've sent that out to all of our middle and high school students. And those results then can be combined in order for youth to define wellness and identify the themes that bubble up in Northeast Spokane, describing what wellness looks like in our neighborhoods, and finally, telling community partners how they can proactively support it. So with this launch of the wellness survey, we thought we need a youth leadership body to own the data and the reporting. And so we thought, well, let's just start a club. We have a project-based high school, On Track Academy, on our campus. And we thought that could be the nucleus of this youth wellness voice. So we approached the principal and pitched this once a week after school club. It was quickly turned into an accredited elective plus course in youth wellness, and recruitment began. And this is just, the end of September, recruitment began, and there was huge interest. Youth were saying that they were there to share their voice and the voice of peers who wouldn't stand up for themselves. And so that club turned into 2 credited plus classes that are being offered during the school day at On Track Academy with our zone staff, both embedded at the school and from our zone at the Northeast Community Center. So each student is creating their own visualization to present what wellness means to them and how community can support that, as well as the class is looking at the data to name the top handful of priorities from the entire zone that youth, community, business, and government leaders can take action on. So now that we have the data collectors, the data crunchers, the data presenters, how did we amplify that voice? Our zone youth resident steering committee member, our youth member, is also a part of Chase Youth Commission, which is countywide. And so she pitched youth wellness this year as the theme for the Chase Youth Commission, and they took her up on it. And so they want to host a large event at City Hall, showcasing the priority areas of youth that our community can proactively support. And because of that brand, we'll be able to get residents, community leaders, elected officials, and large agencies such as our Chamber of Commerce and Health District to attend this student showcase. Additionally, another countywide youth leadership organization, Youth Leadership Spokane, is going to make attending this Chase Youth Commission Youth Wellness exhibition a field trip for this year's participants. where the students in the Wellness Plus course and On Track Academy will present wellness strategies to the youth, community members, and power brokers locally and at the state level. So finally, taking action. After these community presentations, the zone will then follow up with the convening of youth, business, civic, and community leaders to select the youth elevated strategies to start working on with continued oversight and reporting back to the youth in our community.
Thank you, Jenna. Ryan, do you mind jumping in with a similar, give a little bit of background on who you are, RISP, and how your place is approaching this project?
Yeah, for sure. Good morning, everyone. Assuming you're still here joining from the Pacific time zone. Good afternoon if you're not. Ryan Quigtar, I'm the executive director for the Renton Innovation Zone Partnership. As in our name, we work in the Renton School District, a subset of a few neighborhoods within the school district. I also wanted to go back to your original question too, April, around why local or place-based partnerships are important. So I jotted down a few things. I think just off the top of my head, local context is always important. And as Senator Torres said, in her region, her area, understanding being rural and the disconnectedness, that is different from us in Renton, where we're not as rural, and there are places to access maybe quicker or those kind of things. So I think the difference there is already why local context is so important, and understanding where people are trying to do their work, and the uniqueness of that, right? So systems are different, policies might be different, access to funding is different. All those different variables factor into how we show up as place-based partnerships. The second thing really regarding that is just relationships matter. One of our key things in how we address this particular initiative or just our strategies overall, is how are we reaching out or connecting with disconnected families? Who are we meeting in our day-to-day, week-to-week, month-to-month, who casually say, "Oh, I had no idea this existed," or "Oh, I had no idea that was what that business is." Those are things that happen every day in our communities, and our ability to reach those families, reach those students is so important. So our small nonprofits that are in our partnerships, they work with, they might only work with 5 families or 10 families, but their ability to reach them is super important. And now those families are hopefully, able to access care or the resources they need. And then the third thing, just real quickly around that first question, the ability to have localized solutions within our place-based partnerships, I think it helps create ownership from a neighborhood, from a community, from a school. And I think also too that goes a long way on the other side of things when we talk about accountability. Um, Everyone understands, what their role will be in implementing said strategy or designing said strategy. And, in my experience, it has helped with reducing, I won't say eliminating, but reducing the finger pointing, if you will. And so I think that's very helpful, when we're in communities who have been disinvested, fractured for many different reasons. A lot of times that is the case, but when there's local solutions and the ownership is increased among the people who live there, that definitely helps. Um, in terms of our wellness zone approach and what we're working on here, so our specific focus is around middle school transition. That's where we have noted a lot of community need. So specifically, fifth to sixth grade transition. So this idea started probably in 2020, 2021. Uh, First, just recognizing a lot of our partners were already serving or working with middle school students and families, also even at the high school level. And at the time, that wasn't our focus. And so this need was always coming up in conversations with our partners in strategic planning and our action team work. And in 2021 or 2022, we held some community cafes with students and families with fifth graders, soon to be sixth graders, and then also sixth and seventh grade families who were on the other side of the transition. And, we just heard a lot around one, anxiety, going into a bigger school, more students, reputations around what the school environment was, and so on and so forth. And I think that has been something that um, not only fifth graders were thinking about or hearing about, right? Like these are second graders also hearing about these things, third graders hearing about these things. So over the course of time, uh, each school year anxiety built. And so it was even to the point where this past summer, we were talking with elementary age students. We have a summer learning program. And so we were talking with them, and we had a survey we were going through, asking them questions, and we asked them, the fifth graders specifically, uh, they just started fifth grade this fall, and we asked them already about middle school. Their body language, their tone, their face changed, very noticeable. And for us, it was very easy to see too, like anxiety, thoughts, fear, is definitely something to name in this process. And so ultimately, through this work, we're looking at increasing sense of belonging, and trying to align it with, again, our summer learning program and all the things that our partners are doing. So to put very simple, at the end of the day, kids are really, they really care about, and students, I should say, kids, uh, do I know someone when I get to middle school? Like it ultimately can boil down to that one factor. That's one of the biggest things. Do I know another student? So we have 3 or 4 schools that matriculate into one middle school, and a lot of them don't. And so they're starting off with not knowing anyone, and it just kind of trickles from there, and that impacts so many different things. And so I think that for us is kind of the crux of what we're trying to do with our wellness zone initiative. So the curriculum, we're running a program, it's called the WEB program, where everyone belongs. And it's done through the Boomerang Project, which is a national project. They also have a high school transition model. It's called Link Crew. We're not there yet. And so we're just really working to adapt it specifically again to our local context and our students, and just working through that. So thank you.
Jenna and Ryan, I hope you guys could see some of the audience reactions happening as you were talking. Okay, good. Seems like everyone's enjoying what they're hearing. Claudia, you want to jump in? And I will say that note, I'm sure she'll be able to, that our newest place-based initiative, Wellness Zone, is the Parkland Initiative. It's only existed for 2 months now, but Claudia has worked with a group of community members for many years in this area on this subject, and can speak today in her role as community engagement director, partnerships director for Franklin Pierce School District. Thank you for joining us, Claudia. If you don't mind giving us a little bit more information about yourself, and then also anything about the Parkland Wellness Zone initiative, of how it came to be and where it's at right now, would be great.
Yeah, thanks for having me. I'd be remiss if I don't also recognize my partner in this work, who can join us on the panel in particular, but Ashley Mangum is the Director of Kids Mental Health, Pierce County, who has been pivotal in helping us lead this work. My name is Claudia Miller. I have the privilege of serving as the Director of Community Partners, Family and Community Partnerships for Franklin Pierce Schools. As Ryan was sharing, something really important to recognize about community is understanding the context of who is here, the history and the present of what is happening in our community. And I am a social worker, so I often think about the ecosystems that our children exist in beyond us. And why it's critically important is why place-based is super critical for us here in Franklin Pierce and the greater Parkland area is Franklin Pierce schools exist in completely unincorporated Pierce County. So we represent Parkland, Midland, Summit, Waller, unincorporated Tacoma. I'm I'm forgetting a couple, Parkland. So oftentimes the school acts as the civic structure for lack of civic structures in this particular area. And often we are the ones who families and community and students come to for supports and resources in a variety of different areas, particularly around wellness. And in really trying to navigate partnerships that we have and trying to get families and students the support that they need in their community, we are often lacking in those areas. But we also recognize as a school district, as a place of where education happens, is that we're limited in the supports that we can offer our families. But we are not limited in the relationships and the partnerships that we can build with those providers and local organizations, but also our families and communities and students that are part of this community. So it is critically important for us to understand, again, the context and why it's critically important for families and students to have a voice. I often also have to recognize that as providers and even as educators, we often are commuting into these spaces. And so it's critically important to honor and validate the real lived experiences of the people who live here every single day and experience life here, and our children who experience life here every single day. So having a place-based approach that really honors and is rooted in co-design is critically important to wellness as a whole community. And yeah, we're in our infancy stages here, but really excited to be able to collaborate with a variety of local partners, particularly with Kids Mental Health Pierce County at the lead of leading this work in our community. I don't know, April, if you wanted me to speak to kind of what the plan is, but we through Kids Mental Health Pierce County, there is a program called the YES program, Youth Engagement Services. We're tailoring it to be Youth Engagement Parkland, so we're calling it the YEP because we love our acronyms. But it is a clinician that will be based at one of our middle schools where we have already developed a wellness hub where it's part of it is a family resource center, and the other part has designated space for clinical and more one-on-one supports and services. But we'll have a clinician that will be on site to work both with youth who are experiencing crisis or can provide behavioral health navigation to other resources and supports. It will be kind of the conduit between most of our behavioral health supports that come to that school. They also will provide supports to staff in terms of training and support to help empower them to recognize what wellness looks like in our kiddos. So we'll really build around prevention and intervention services from a clinical perspective based at the school where children are at for 7+ hours a day, oftentimes. So we're really excited for this opportunity to kick this off and to really try to be centered where our kids are and where they feel most comfortable, where they feel connected, and also to continue to elevate their voices to expand what this also can look like beyond the school space and place.
Thank you so much, Claudia. You guys have really hit the ground running with less than 2 months into this initiative, and I'm very excited to see what happens. I am going to ask Senator Torres now kind of a two-part question. In the spaces I work, many of these incredible place-based leaders are in those spaces. We often talk about the importance of youth voice and co-designing with those impacted to create and implement strategies. Like that is just a given of how we all approach. It's not really a given in all areas, and especially in my experience, not always a given in government or public policy spaces. So I guess my first question to you would be, what made you think to champion something that was about youth leading and youth voice, youth telling us what they needed in order for us to address this crisis? And then also, if you could dream up like what's going to come from this, what would you say to all of us?
Well, great questions. First, as far as youth leading, it is important to hear from our youth because sometimes we can assume just because we were once a youth that we understand what they're going through, but times have changed. I mean, let's face it, times have drastically changed. So we need to ask our youth what's going on and hear from them on what they're feeling, what's affecting them, why they feel the way they're feeling, and really have an open door of communication for them and a safe place for them to do it as well. We need to have we've always heard this, it takes a village, and it really does. So having those community partners, I believe Ryan touched on that as well. And Jean brought up, the student showcase. Those are some great ideas to bring together the students, to hear their voices, to encourage them, to empower them to do so, because at the end of the day, that's what we need to be doing. We need to be empowering them and making sure that they're well and that they're going to succeed, because that's what we want is our future leaders are the students that we're seeing right now. And in my area, we're seeing a lot of agriculture. So we have a lot of students that work in agriculture. I come from an agricultural background as well. I also worked in agriculture till I was about 14 years of age. And, it's tough. So hearing from those students, and their needs, not much has changed in that aspect, but they really struggle with opening up. And hearing from them is really important. But of course, we're still seeing the shortage in workforce. And I think that having these wellness zones is going to be very impactful for them, and especially encouraging them by empowering them. And then as far as what I would like to see, I think that was your second question. Was that it? Was what I would like to see come out of the wellness?
Yeah.
Okay.
Yeah. If you could dream big of what came out of this project after, let's say, 2 to 5 years from now, what would it look like?
Well, having wellness zone, especially in our rural areas, no offense, Renton and Spokane, but more of our rural areas is where we're seeing a really big need. Our kids really feel disconnected, like they have nowhere to turn to. And I think that's where we need to really prioritize a big focus. We're seeing an increase in gang activity as well. And we have a great organization called Spark. I know that they've been trying to do a lot of outreach to the students in our rural areas. And, as mentioned earlier by both Jean and Ryan, community partners is going to be, having those relationships is going to be a really key factor. And I think that we're going to do that by having these wellness zones. And that's what I would like to see in 2 to 5 years, is having wellness zones in those rural areas, but really strengthen relationships, because it does take a village. So we need to have those strong community partnerships and relationships.
I love that. I think many of us in the place-based collective impact world would tell you that community partnerships also existing and continuing their ability to support different communities is also our 5-year dream. I'm now going to turn us over to the partnerships we have here, the zones we have here, and ask each of you to share a little bit about any youth feedback you've heard recently, any findings from conversations with youth, or any themes that you feel like are coming up. Ryan, you touched on this a little bit, but if you wanted to expand, I'm going to start with Claudia, though. What are you hearing from young people you engage with about their mental health, their well-being, their emotional health?
Yeah, I think what we're hearing a lot from students in particular is a desire to, again, I think Senator Torres brought it up, a desire to define what wellness looks like for them. And it doesn't always meet our criteria of what wellness or mental health services looks like. And so they want us to be creative, and they want to be heard, and they want to be respected. And I often think about, we talk about them as the future, but they are the now. And so how are we pouring into them now and cultivating the individuals that they will become in the future? And so I think we are really hearing from them a desire to be heard, that it's necessary, because we're irrelevant. I mean, I can't keep up with all the words that they say, but I think we need to be relevant. We need to be in the know, and nothing about us without us. And they will school us up really quick. And in order for any work to be successful, they need to feel invested in, they need to be part of, and that is exactly what we're hearing. Like, they're not going to join the party if they didn't help plan the party. And so it's it's critically important for us to keep that at the center of the work that we are doing. It's only going to be like successful as they feel it is, as they feel invested in. And so I think that's our, you know, our North Star is to continue to have them be at the center of not just voice, it's also choice, it's decision making, it's action, it's involvement in all of that. So that is really what we're hearing from them. Like, and I think there also is skepticism. Oftentimes in our youth, we survey them like you wouldn't believe, and we ask questions, and oftentimes as adults, we don't have the proper channels to take that feedback and make it into real live things. And so I think that there's some trust building that also has to happen because it's just partnership work. This is relationship work, and we have to build that, and it will only move at the speed of trust. So
Thank you so much, Claudia. Ryan.
Yeah. So I think for us, also seeing all these comments here in the chat, so I think some of my response will hopefully answer some of these or speak to what people are thinking about. So appreciate everyone participating in the chat as well. I do want to start with the I think Tamara's comment around bullying and what that does around you know, mental health issues. So again, going back to the web program, the format of the structure of that program is the 8th grade students are the mentors of the incoming 6th grade students. And the process starts actually when those 8th grade students are in 7th grade. So there's a series of trainings and recruitment that they go through. It's kind of their interest to do these things. So it's not like we only go to a leadership or ASB class and we handpick these students. It is open to anyone. They indicate their interest there, and there's a training, there's orientations, there's all these different things. And so the idea with that is one of the specific things is to decrease bullying. And again, it's not just having a friend who's maybe another 6th grader, but also an older student in the building. Oftentimes, there's reputations with students. They can vouch, if you will, for other students in situations. And so this, again, things are that we're hearing. So the format of having older students participate and not just being a 6th grader in this program, it involves more of the entire school body. So for us, kind of what we're hearing and looking at, that led to what I was just sharing. Some information that we've been paying attention to are the school climate surveys. So every year, and actually this month, in the Renton School District, they do a school climate survey. And so we are looking at 5th grade school climate survey. So again, 3 elementary schools that we're looking at specifically, and then also 1 middle school. And so we're kind of cross-referencing that. So we're not looking at the same years, right? Like we're looking at, let's see, this year's 24-25 school year. So obviously last year's data is the now 6th graders. So we're tracking to see too, are things the same? Have things went down? Have they gone up, and why? And some of the things, you know, for us, is right now we're seeing a trend down. So as a 5th grader, you have a certain sense of belonging. You have, you know, maybe an adult that you trust. You feel safe, like all these different questions that are built within the survey. And once they get into 6th grade, some of those answers, the percentages go down. So obviously, naturally, we're asking ourselves, why is that? And so I think that's kind of where we are right now, is getting into those details, talking with students and families. The piece I also want to add in here too is what we're kind of adjacent to this web program design and implementation, is some of the work that my counterpart in this, Haya Munoz, she was not able to be here today, but she's actually leading this work for the middle school transition, is when talking with partners who are working more directly with families, the families have actually indicated a huge desire to have some kind of training or workshops around parenting students through adolescence. So specifically in this age, the tweeners getting into teenage years, needing support around, I don't know how to raise a teenager. I don't know, these new behaviors are coming out, or, it's all these different things. I need support. So I think paired with where we are right now at this age with the students, it's not surprising that that's a need. And so again, that could be an adjacent strategy or opportunity for us. So that's definitely something we're looking into. And a data point related to what I just shared, a few years ago, we were talking with the school district, and we had noticed, like there were a lot of questions around specific processes to get in the district, or unfamiliar with, again, where to access certain things. And just a natural curiosity from us, we asked the district, what is the percentage of incoming kindergartners or first graders who don't have an older sibling in their household? And essentially, we're asking, what is the percentage of first-time families in this cohort? 70% of those families were first-time families. So you have to then think, right? The entire K through 12 journey is brand new. Every single day is brand new. Every single school year, something new that they've never experienced. And so guiding them through this, or supporting them and having, making sure they have the supports and resources. And as Claudia put it too, the infrastructure or the civic structure of all the life's ups and downs, that's really important. And that impacts kind of this work that we're doing. So I think that's, definitely some things we're seeing already. And the last point I want to share is just around also engaging the parents and guardians of these students, because I think that is also important to understand access to resources, ability to get there, all those different things, parent consent. So we asked the question, on a scale of 1 to 10, how much control do you feel you have of your child's wellness? And we had 1 being, or 0 being no control, 10 being full control. And the score we got, the average score was 7.4. So I'm any data whizzes in here, you probably have a million questions, and so do we. But the biggest question, one of the biggest questions we had is, what is a good score? Do we want it to be 10 and parents have full control? That's a curiosity we're still trying to figure out that answer. But I think that's kind of one piece that we're like, okay, is this a baseline, or is this an indicator of something else? So I think it's kind of helping us push further to say, let's explore this more, and see kind of more about what that looks like. So really interesting information we're getting so far to kind of keep us going, but excited to see what's next. So.
Awesome work, Ryan. Thank you so much. Jenna, I know you're so excited to share some findings.
I am always excited to share findings of Youth Voice, and we just learned this. We're 6 weeks in, so it's definitely not those top priorities that are bubbling up as strategies for youth in Northeast yet. However, in looking this week at the surveys that have come in and at what is happening at our wellness classes, what is wellness? Mental and physical health definitely came up, and they're working in class to support themselves mental health. So some of the things they're doing are making suicide awareness pins together. They also want to make t-shirts and sweatshirts that have affirmations on them, as well as a suicide helpline that they can all wear that says, hello to the person behind me, you matter, the world needs you, it's okay to not be okay. And those resources for youth, so they're really looking at kids around them. They also invited guest speakers, parents whose son died by suicide, and they invited the entire student body to listen to these parents talk about some warning signs and resources and lessons learned. And so they're sitting with something that is very, very heavy when you start with mental health, when they are really focusing it on suicide prevention. In physical health, they're researching healthy food and how, eating some protein in the morning can help you regulate your body through the day. So it'll be interesting to see what other physical health themes surface. For community support to wellness, safety has been raised. There's comments about dirty needles in parks and garbage on the streets, and also no place to go if there's trauma at home. So in several different spaces, it elevated having youth having a safe place to go if where they're at isn't safe. Very interesting. They do care about a sense of community and emotional health. And I hadn't thought about this idea. They're asking for parents' mentorship, where youth missing moms and dads can be mentored by parents. And so really setting up those mentorship relationships to provide that guidance. And in skill building, they want to build skills to support their stress and their anxiety, to support coping with those things. That includes having someone to talk to, and again, having a place to go if something traumatic is happening. Specific request for skill building. Ryan was talking about student-to-student mentorship and interaction. They want to know how they can help their younger siblings focus on positive instead of negative things. So how can they be older siblings and help shift that mindset of their younger siblings? They are very anxious about climate change. They feel like it's too big of a problem to face. They don't know how to be a part of the solution. They just hear how bad it's getting and that they will be the recipients of the worst. And so they would like to proactively understand how they can support climate change. For the physical environment, which has been surfacing as wellness. Wellness means that physically I feel good. And the word they used was dire. There's a dire need for housing ages 16 to 24. Many of the youth in the class are homeless themselves, couch surfing, or they have homeless peers who are still showing up for school. And so the practical things that they're asking are really something that we often think of as an adult would need these skills, something that's beyond high school. But they're asking for how to fill out a rental agreement, the rights and laws of tenants and landlords, how to buy a car with a loan, how to pay for school, and what those loans look like. So exactly as Senator Torres said, we really need to recalibrate the things that are worrying our youth, the things that are causing anxiety. And some of those community solutions are skill building and support and mentorship, as well as physical spaces and places in our neighborhoods. So for our next steps, and the next time we get to report back to you, I hope, we are prioritizing common themes from the surveys, the class, and youth conversations, youth to youth, peer-led conversations in the community. We're creating displays of the wellness needs and how community can support that. We're presenting to different groups locally and at the legislature. And then we're convening business and community partners so that they are ready to take action on priority strategies. And we have a very good track record in Spokane. We just opened a community-based, school-based behavioral health clinic that was completely undertaken by a convening of community partners, residents and community partners. And everyone came with their own resources. And now we're serving over 900 appointments a month right here at our community center, right here on this campus. And so it's that same group of partners and power brokers in our community that can come together and also action some mental health supports for youth in our built environment in our neighborhoods. So very excited. Thank you.
Thank you so much, Jenna. I hope you were seeing all your reactions. Everything Claudia, Ryan, and Jenna said seemed to resonate with what I think is an audience of all the practitioners and mental health experts from across the state of Washington. So folks are probably seem to really be resonating with what you're saying. I wanted to jump into our question and answer period. I saw two main questions I'd pose to whoever in our panelists want to jump in and answer. And then if you do have a question, please add it to the chat or add it to the Q&A box after we get through these. We will jump into that. The first one is a super easy, very easy to answer. But I'm actually going to ask Senator Torres to maybe answer from a Washington State perspective and her ideas. And then maybe Claudia answer from a school district perspective. Do you think there's a chance we're going to ban social media? The gentleman who wrote this, and I, as a mom of young children, there is countless resources or research out there everywhere you look about the ill effects of social media on youth mental health. And I'm scared and I don't really know what to do. And I have a few years to figure it out. I think there is a push from some folks to ban it completely until a certain age. And I think there's probably a lot of debates out there, but if you had to answer from your perspective and experience, do you think there's a chance that there would ever be some sort of system ban or system regulation on social media use?
Well, I know that there was a bill proposed last session by Representative McClintock to ban cell phones in the schools. And it wasn't specifically targeted to social media, but that was one of the big reasons or one of the big factors for that. And also to reduce the distraction. When I mentioned in my intro that our kids from our students, look at us and we want to hear their voice because, times have definitely changed. And what I meant by times have definitely changed, we didn't have the technology back then that we do now and access to it and all the information at our fingertips like they do now and the misinformation that they're seeing on social sites. So I would, as a mother and a grandmother, I definitely I have two grandchildren that are teenagers, and I would definitely be for, banning social media for up to a certain age. And I don't think they should have social media accounts, but I know some parents aren't going to like that because they want to have their choice. And I get it. And, some school districts are considering taking it on themselves and banning phones in the classroom, which includes having access to the social media sites. And I know some of them already do, if they have computer lab, they don't allow the children to get onto those social media sites for that reason. And because we've seen an increase in anxiety in students. And one of those reasons, number one, we look at holistically what's going on at home. Number two, what else are they using or what else are they looking at? And a lot of times it's the social media sites where they're getting their information or where they're spending their time at. And half the time, a lot of our students that are in ag areas or rural areas, as I mentioned, they spend quite a bit of time alone because parents are at work or they have a single mother household like I was. And, they're alone from 3 to 6 sometimes. And so there's a big gap right there where there's no one around in the household and they're pretty much raising themselves. So we need to make sure that we have something that works for everyone. And even if that means the school districts taking the charge themselves to ban cell phones, or not allow cell phones during instruction time, I think that's going to be important. But also looking at, do we need to ban social media up to a certain age? I think that's something that we definitely need to discuss during this legislature.
Thank you. Claudia, any talk from your school district about this issue?
Yeah, so I know there's been lots of conversation about our sphere of control in terms of what access happens at schools. I know from a technology standpoint, there is a lot of firewalls to ensure that the kids are not accessing things they shouldn't be accessing while they're at school. I think, though, the part of the conversation needs to be also what's at the root cause, because we can eliminate all these things for kids, but they always find a way to access things. And what is at the root cause? What are they getting from social media? I think parts needs to be part of the conversation. I think we also need to recognize that COVID had a really huge impact on just the as human beings, we have a desire to be together and a need to be together and to create those communities and sense of belonging. And that was not part of a lot of experiences that were pivotal years for a lot of children. And so what is at the root cause of them using social media, and what are they getting, along with the conversation of how do we address it? And I think just also as part of like a learning organization, how are we educating children to utilize the tools that are available to them in a way that is healthy, that is responsible? I think we also have had a conversation around AI, like, get rid of AI, but like, how do we use it responsibly? How do we use it? It's part of the experience now. It's part of what is part of our children's experience now. And so how do we both support and protect our children to use it in a responsible way that'll hopefully eliminate some of those pieces, but also, help cultivate some restrictions around that. So.
Really appreciate that perspective, Claudia. And it goes with the nothing for them without them comment that you made. I think that also applies here. The other question I saw, which I thought any of you and all of you might be able to answer, was if somebody was looking for mental health services, where would you tell them to look? And I think you could all answer that from your different vantage points, if you don't mind. Anyone can jump in first. Who's ready?
I can go. What immediately comes to mind is, I mean, part of this work and part of why RISP has a that's our acronym. It's a lot shorter than Renton Innovation and Partnership, by the way. I think, like, honestly, when you just asked that question, April, my first inclination was I don't know. And that, I mean, just is sometimes, I mean, a lot of times reality. Thankfully, after thinking about it 10 more seconds, for students in the Renton School District, there is a school-based health clinic operated by HealthPoint that is accessible to any student in the Renton School District. That's one. I think some of the work that we have helped champion and kind of raise in the different neighborhoods that we serve, there are two physical places. One is coming online in early 2025, but there are now two resource centers, one in the Renton Highlands and one in Skyway, that we will have, and specifically there are mental health providers there. I think another piece, though, not a direct answer to this, but just want to surface too, like language is a barrier to accessing these things. So I can go online and maybe on a school district, if, as Claudia was saying too, a lot of times school districts try to have a one-stop shop of all these different type of resources. But if English isn't my first language, I might not be able to navigate to what I need to see and what I need for my family and my students. So I definitely just want to surface that up as well, where that's still some part of the systems that are not fully worked out yet. And I think across us here and other, state partners, that's definitely something that, we're trying to help and support.
In Spokane, of course, the school district has their own mental health staff, but what we were seeing is a huge waiting period, even not able to be served that same year. And in our neighborhoods in Northeast, it was about a 6 to 9 month waiting period for a youth that was being referred to see a therapist. And so that's why we had that community effort to open a community-based, school-based mental health clinic. So now it's located right here on our campus, and it is definitely a warm handoff, warm referral, walk someone over to the clinic because it's considered school-based. Kids can just get a hall pass, go have an appointment, go back to class. They don't have to be escorted by a school district staff or anything. It's just right there. In addition, if you're not right here on this campus with this set of schools, we have 4 CHAZ health clinics that are clinics based in our schools, and they all have behavioral health. If you're not in one of those schools, you can virtually get an appointment the same day with those providers. So that is a community partner that is supplementing the school-based mental health services that is a caseload school by school. And it literally, they'll help you the same day, and they have both physical and mental health. In talking to them, many kids have headaches, or they have stomach ache, or they have other physical symptoms that they are used to and that have happened for so long that they don't even understand it's not normal. And they definitely haven't made the association of it coming from emotional turmoil or some type of mental health issue that's manifesting itself physically. And so in those 4 clinics, you can meet with the team, both the physical and mental health, and really get to understanding some solutions to feel better holistically.
Thanks, Jenna. I'm very sad to say, because I feel like we could keep talking, that we're coming to the close of our hour. Thank you all very much for your time. Thank you to Ryan, Claudia, and Jenna for sharing, and quite honestly, just fundamentally, thank you for the work you do every day. Senator Torres, we're sad to see you leave your post at the legislature. We hope that leadership positions are on the horizon for you in the future. Thank you again for championing this work and coming here today.
We still have 2 more years.
Okay, great. You will find up on the screen right now contacts for each of the folks involved in this project. You have the 4 zones: the Zone Out of Spokane Rent Innovation Zone Project, the Parkland Wellness Zone, and Yakima Valley Partners for Education, as well as the contact and website available there. If you need anything, my information is up there, as well as our incredible partner, CoLab, at the University of Washington. So I just want to say thank you to them and their whole teams for all of the work that they do for this. You will find 2 links in the chat. One is the hot off the presses report. The first report about the Wellness Zones initiative is launching today. It's exciting, a first look at the point of this project, the approach, early findings, and hopes from each of the sites and the project as a whole, as well as a link to sign up to receive up-to-date information about this project as we go. I think the hope is that we will do another webinar next spring and then potentially next fall again as additional information comes from each of these sites. Thank you all very much for joining us, and a recording of this and the resources will be available, I believe, emailed to you. I will make sure, and if we did not get to your question, I promise I will look at it and try to respond. Thank you so much for your time, and I hope you all have a great day. We're here if you have any questions.